Good morning, everyone. Scott Mabor here with your Medicare Missive, back at the pond for Monday, the 18th of August. Hope you all had a great weekend. Oh, it just got dark. Let's see. I was in Dallas last week. Fabulous training. The group I'm a part of that was that meeting, made up of long-term care people and Medicare people. So both specialties. And I always learn a lot, get some great suggestions both on the Medicare side and on the long-term care side, which, if you've watched my videos, you know I'm a huge proponent of doing some long-term care planning. So that could be insurance, it could be a Medicaid trust, it could be, that's basically it. Those are kind of your two options. You can self-fund, but if you're going to self-fund, you're probably better off with an insurance policy and just leverage the insurance company's assets rather than yours. A discussion for another day. Last night I was flipping through my phone and there's an article from Yahoo Finance. I did post a video while I was away on this topic, but it came up again. So the government is pilot testing 6 states that they will have prior authorization on certain procedures on your Medicare Supplement. And I was reading the feedback on this article, and I will post this link. It's very interesting. I mean, because on the one hand, they're going after the Medicare Advantage plans for doing just that, for denying claims due to prior authorization. And then what they're doing is adding prior authorization to Medicare Supplements. And I always tell my clients, for good or bad, Medicare Supplements have basically no oversight. For the long-term health of Medicare, probably not good. But in terms of you as an individual, you get a Medicare Supplement, you can see any doctor. Fabulous, no network. If they take Medicare, they take your supplement. The other thing is, there's no oversight. So if it's a Medicare-approved procedure or treatment or whatever, doctor orders it, trying to get out of the sun, sorry, you're good to go. Now in this pilot program, there is oversight, and it will be initially done by AI, which is the exact thing United Health and others get criticized for, and then it will be reviewed by a human. I don't know where it goes. I think it's kind of interesting that on one hand they're telling the Advantage plans do less oversight, but we're adding oversight to a supplement, which I would say is one of the primary reasons people are willing to pay a couple $100s a month for a supplement over having an Advantage plan that has no premium. We'll see where it goes. I think it's concerning in some ways, but I think it also makes sense in some ways. But it's I can't imagine it won't influence more people to take Advantage plans, and in my humble opinion, that is the ultimate goal, to put more people, just for those who don't know, an Advantage plan is a private insurance policy that literally replaces your Medicare with the private insurer's coverage. Most people don't realize it's technically replacing it because you have to have A and B to get it, and you continue to pay your Part B premiums, but the premium is now sent to the insurance company. There have been talks that this administration would really like to see Advantage plans kind of replace Medicare, so effectively privatizing Medicare. If you equal the playing field, why pay $200 if you're going to start restricting the supplement? It makes the Advantage plan more attractive, puts more people on Advantage plans. And keep in mind, this is a generational shift, so those currently on Medicare may not change. Those coming up to Medicare age may, and then people who are a few years behind them are going to be more and more likely to go one way over the other. That's my suspicion or my interpretation of this. Could be way off, and you can certainly disagree, but I think that the goal is to make Advantage plans that much more attractive, and not necessarily officially privatize Medicare or force people onto private plans. But if you balance the playing field and the Advantage plans simply become more attractive, and you get dental in, blah, 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 maybe people do start leaning that way. And at some point, instead of having roughly a 50-50 balance, you start going 70-80 balance, and there's just fewer and fewer people on what's known as traditional Medicare. Those are my thoughts. Have a great day, everyone. I'll put the article in the post, and if you have any comments, feel free. Always happy to help. And don't forget, open enrollment period is going to start soon after Labor Day. If you're not already, your mailbox will be filled with advertising telling you all about your new Medicare plans. This year, be very careful. Check your plans. A lot of plans are leaving. A lot of drug plans are going way up in cost. And that's going to hurt a lot of people. You're going to go from $12 to $50 a month. So I anticipate a lot of that type of price changing. Let me know if I can help. Have a great day, everyone. Enjoy.